guys, welcome back to Medical Coding with Blue. Today's episode is all about remote medical coding, what you should know. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, lately I have gotten a barrage of emails from people saying that they are interested in medical billing and coding simply because they want to work remotely right away. And I did get a message from a lady who said that people around her didn't think that she would be able to get a job if she didn't have at least 3 years of experience. Now, here's the thing. What I say today is going to probably make some of you mad. and you may unsubscribe, you may do a lot of things, you may leave a dislike too at it while you're at it. But I will say this, if you do, guess what? YouTube sees that as engagement and they're going to push my content out more. So if you truly don't want this video to get out there, don't do anything. Just stop watching and don't even like, don't even hit that thumbs down button either, because again, every single one of those thumbs up or thumbs down, every single minute this video is watched, YouTube will see that and push it out. So I'm just saying that. The other thing is this, we're all adults here, guys. We can speak frankly, and I will not sugarcoat what this industry is and what it's like to be a remote medical coder. I've done many videos on my channel about remote medical coding and what it's like. I've also done specific videos where I say it's not good for new medical coders to work remotely, and still I get the response, Blue, I know you said that it's not good, but I want to do it anyway. Okay. So let's look at all the things first, okay? Let's be adults about this. Let's look at the things first. Everything that goes into remote medical coding. First of all, you have to have a secure area in order to be able to set up your equipment. So a lot of times the companies will send you a computer or a laptop and monitors and things like that because they need you to work with their equipment because it keeps the records safe. You have to have a secure internet connection. You cannot just be traveling and going out there willy-nilly to all these places and connecting to Wi-Fi, because when you do that, you put the medical records at risk. And these medical records and these people's protected health information are protected by laws, okay? There is a lot of fines and a lot of stuff that goes into if this information gets out. So I want you to think about this. When you are trying to pursue this simply because you want to be able to go here, go there, and do all these things, this may not be the field for you because it requires you to be able to concentrate, which leads me to my other thing. If you're saying, Blue, I want to work remotely immediately because I have a house full of kids and I have a new baby and I need to be able to take care of them, you are not going to be able to look at your screen, stop every 30 minutes, every 10 minutes to go tend to the kids and get back and still be able to maintain your productivity and your accuracy. Because guess what? Your productivity standards are always going to be higher when you're working remotely. And if somebody that's brand new, that's going to be kind of hard because you're going to be slow at first. You have to also get used to the electronic health record, which they don't really teach you in the school. They teach you about, or even if you're studying on your own, they teach you about the coding aspect and they teach you about like reimbursement and HIPAA and all these things, but they don't teach you really about the electronic health record. You may get exposure to the encoder, but that's not the electronic health record. And even if they have like one that's like a sample, it doesn't mean that's the particular brand you're going to be working with, because there's some major players out there when it comes to the electronic health record. Of course, there's Epic, Cerner, eClinicalWorks. Those are the big ones, right? And then there's a bunch of other little small ones, depending on the size of that facility. So everybody's going to have a different electronic health record to learn. These electronic health records are no easy feat to learn to use either, because you have to have so many screens up and then you have to be able to, or windows up, and then you have to be able to find what you need or get to the queue and enter the information in. So it's not just the coding part that you don't have experience with yet, but it's also learning the electronic health record. Now, it is much easier if you are sitting next to somebody, or if you're, in an area where somebody from IT can come and help you if you get stuck, because you will get stuck. These electronic health records are not easy to maneuver in sometimes. And sometimes if the system and the package that they use is not intuitive, you're going to have an even harder time. My facility just went to a new electronic health record here not too long ago. And I'm telling you what, guys, it is still difficult even for me to maneuver in there, because I'm like, where do I go? But that's what you have to know. So you're going to be learning a lot of things while you're at home. And somebody else wrote me and said, well, Blue, I live in Mexico, and I want to work in Mexico, but I live here in the U.S. I have a U.S. address, and I can stay here and get trained, and then I can go to Mexico. No, you can't, guys. This is not for those that want to work overseas, like live overseas. I don't know every company in the world, and maybe you know a company that allows that. And if you do, that's wonderful for you, but that's not the usual case. When you're working remotely, sometimes they need you to live in certain states because of rules about taxes and all that other stuff. If you look at the job listings, you'll see that they say, oh, cannot be a resident of such and such state or such and such state, because they have different rules about working remotely. So that's another thing that you have to think about. And before you think, well, who's going to know? I'm just going to plug it in. Who's going to know? These computer tech people, they know exactly where those computers are, because you're supposed to give them your address so that they know where you are. There was a lady that said that she didn't want to put in her leave, but that she was going to go down to Mexico and be on vacation and still work. She connected to the hotel's Wi-Fi. Literally within minutes, the IT people were calling her and saying, where are you? She's like, oh, I'm working, I'm at home. They go, no, you're not. You're connected to, that's funny because the IP address for this computer is connected to the Wi-Fi at this resort hotel in Mexico. You need to shut your computer down and bring our computer back. Needless to say, she got fired after that. So that's the thing, guys. This is not where you can just do whatever you want to. And for those of you who think, well, if I work at home remotely, I can just work whatever hours I want to. Again, this is just an unrealistic way of looking at this career field. And if somebody's telling you that, oh, yes, that's totally possible, they're wrong, okay? I have had 2 experiences working remotely before. I worked for a level 1 trauma hospital. This was a very pleasurable experience because at that organization, at the time, they said as long as you get all of your work done within the week, you were good to go. So you could work anytime that you wanted to. In that instance, yes. However, they did have a switch to, okay, well, we need to make sure, because some people are taking advantage of it. I was always on time when I was doing my stuff at home. I was always on time. But there was other people that were taking advantage. And when you have people who take advantage, that's what ruins it for everybody else. So the vast majority of them in the job listings will say, if you're working remotely, you must be available during this time in this time zone and such and such. They will say that. And because they need you to be available when the doctors are there, so that in case they have questions and in case they need you to do something right away, you can do this right away. So don't think that just because you work remotely, you can just work whenever and you can stop and take care of the kids and do the laundry and do all these things, because you can't. And that was one of the first things that I was told, even when I worked my first remote coding job, and that was for a level 1 trauma hospital. I did a lot of same-day surgeries. I did some clinic work, but I did a lot of same-day surgeries. And this was tough stuff. This was that I didn't have anybody else to go to ask questions if I got stuck. And I didn't have anybody to like back me up and say, well, what do you think about this? Because when I worked, it was in the evening time. And so what I got was all the crap that was left over from the day shift, right? People that were working during the day, and I was left with all of the difficult stuff at night. The difficult stuff that ended up being easier for me after a while, because I learned. If you ever work for a level 1 trauma hospital, you'll know what I'm talking about, because level 1 traumas are not easy. It's multi-traumas, or it is a lot of really gnarly things that happen to these patients. And so you have to know your medical terminology. You have to understand anatomy. You have to understand these procedures and what all is included with them. And as somebody that's brand new getting into this field, you don't know where you're going to get your first job. And even if you got your first job working at home remotely, because before the pandemic, you were not working at home remotely unless you had 3 to 5 years of experience, period. Now, there are some companies that will allow you to work remotely, even if you're brand new. A lot of the HCC or risk adjustment companies, they do that. But risk adjustment HCC is only diagnosis coding. Before you get excited, risk adjustment coding is not always considered experience when you go to apply for other jobs. I have seen that personally. Do not argue with me, because I've seen it personally in the job listings where they have said, if your only experience has been risk adjustment, this does not count as experience. Why? Because more often than not, the people that are doing risk adjustment coding, right? They are not working on CPT. They are not doing anything with ICD-10 PCS. If they're wanting to do inpatient side, they're not working with the HCPCS codes. So because of that, they lose that. And if you lose CPT, you also lose evaluation and management. And for a lot of you, that's already a big bad bear. There's evaluation and management is not that hard. It really isn't. But a lot of people have it already in their mind because of other people's preconceived notions about evaluation and management. So, but that's another story for another time. This I want to keep on track. When you are working remotely, your productivity is going to be higher. They are going to expect you to have really great accuracy. That accuracy includes knowing your medical terminology, knowing your anatomy, and understanding what's included in certain procedures, knowing how to apply modifiers. And so again, when you are starting immediately remotely and you're not having that time around other medical coders, you're missing out on your development as a brand new medical coder, because you need them to guide you and help you to learn the things that you didn't learn in school. Now, there's a lot of things I talk about on my channel is the stuff that you don't learn in school, but you're going to miss out on a lot of that other stuff, especially if you just immediately work at home. Now, if they train you first at the facility and then they send you home after 3 months, hey, that's a great thing, because you've had the time, you put in the time, and it wasn't just immediately that you're working at home, you just get thrown into the deep end of the pool, because nobody has time to sit there and train you and hold you and wrap you in a warm blanket because you want to be new and working at home. They have work to do too. That's why a lot of these companies, they don't want to hire brand new coders, because a lot of them get cattle herded through these really fast medical coding programs. And then when they go through these fast-paced medical coding programs, they don't learn about anatomy. They don't learn about medical terminology. They do not practice with the coding part, just looking up the codes. They do not, what is the word I'm looking for? They do not make the students read the coding guidelines. There are some teachers that do, and I love those teachers. I will love them, because those people that read those coding guidelines and they're made to read those coding guidelines every week in their program, those are strong people. Those are the people that actually do get it. But there's a lot of these fast-paced medical coding programs, and you get what you pay for, by the way. And you go through these fast-paced medical coding programs, and then you get taught next to nothing. And then they're expecting you to expect the employer to train you, in which that's not fair. And that's why a lot of these coders don't get hired to work remotely. Now, I'm just saying, it's a harder battle if you're going in with that thought in your mind that you only want to work remotely and that is the only thing that you will accept. they don't want to hire new medical coders. New medical coders run into a lot of resistance when they're applying for jobs. And a lot of times it's because they don't have a really good resume. I've done videos about the resumes. Don't ask me. Just look through the videos, guys, or Google. You can Google, because when you Google, even my videos come up. Okay? You can Google that if you don't want to look through YouTube. The resume is not good because for some reason people just don't want to write resumes. Resumes are not that hard, y'all. It is really not that hard. But again, that's something that people say, well, I don't like to write. You need to get rid of that, because when you're in this industry, you're going to have to be writing. You have to be able to write communication when you're writing to providers. And this communication better be efficient, because if it's not, they don't want to hear anything that you have to say. If you start off your whole paragraph, oh, hey, I hope you had a great, wonderful weekend. I had a great weekend. And no. What do you want? That's the way they're going to look at it, because these providers do not have time to be tomfoolery with you. Okay. They need you to get to the point and tell them what do you need. Okay. Because again, they have all of these things that they have to do. So you need to make your communications concise. You need to make them efficient. And that's the same thing with your resume. And that's where that stops a lot of people, is that resume part. The second part is they don't apply for places that are still asking for experience anyway. If they're looking for medical coders, they're going to have to take whoever is applying. If there's happy coders in that area, they will not move. If you are the only one that is applying, then you're the one that's going to get the call. They're going to say, okay, fine, let's see what this person has. And if you sit there like a deer in the headlights because you didn't listen when I specifically told y'all, practice with your workbooks. Make sure you're reading your coding guidelines. Know where you're applying at. If you don't follow those simple rules and they call you and then you just sit there like a deer in the headlights, this is why, guys. That's why. So when I'm telling you that when you're working remotely, your productivity is going to be higher, they will expect you to get to those high numbers, even though you are brand new. And you want, of course, to work in a place where the numbers are reasonable, not where they are astronomical. Somebody said that they code for the ER and they have to code 200 plus. Honey, that's not coding. That's data entry. That is data entry. So if your facility or your place, that wherever you're coding is, we want 200 plus per day average. No, you need to find someplace else to apply, because that's not coding, that's charge entry. Oh, well, the electronic record already did it. Trust me, when you see in those electronic health records, those codes that are selected either by the provider or by the system, a lot of times they are wrong or they're not as specific as they could be. So that's where you come in. And if you are not correcting it, guess what? It's your name that is on those codes that got pushed through, especially if you did not correct them. So that's why I'm saying. And then you're going to compound that and you're going to work at home by yourself. And you can't be working off the clock either, if that's what you think. Oh, well, if I don't make all my quota, then I'll just, make it up later. I'll just go back and log in. They can see every single time that you log in what record you're in and how long you were in that record. And if you are not on the clock like you're supposed to be, what are you doing? And that could be considered a HIPAA violation too, because you're just going in there willy-nilly. What are you doing? These are the things that I think people don't think about, especially when I get these messages from people that are just like, immediately they want to work remotely, immediately. And I'm like, you need to give yourself time at a facility first. Oh, well, I'm just still thinking. Then don't ask me. Then do not ask me. Because of the simple fact that you already have it figured out. Meanwhile, I've been there, done that, got a t-shirt. I know, and I understand the industry. So versus the person who listens and who says, you know what, Blue? Okay, fine. I will do the 3 months at a place, or I'll do the 6 months working at a facility. And then, oh yeah, by the way, I'm learning. And then I'm going to apply. Oh, I see they have this remote position. In this remote position, they use the same exact electronic health record that I'm using here at this facility. Let me go and apply with them. Oh, you've already been working 3 months, 4 months, 5 months, 6 months. Oh, okay. You have experience with the electronic health record that we use. Okay, this is great. Okay, well, yes, we'll go ahead and hire you because you passed our test. You you spoke with some knowledge about the things that you've done, and you can be ready to work remotely. So that person gets a job working remotely. Meanwhile, the person who has it in their head that, oh no, they don't want to do anything but work remotely right off the bat. And so they're out there putting in jobs, applications and resumes and stuff like that, and they still haven't gotten a call back. This is the same person that's going to be on LinkedIn, Facebook, Instagram, wherever, and saying, oh, I can't get a job. It's so hard. No one wants to hire me. I just want to work remotely and take care of my kids and my family. And why are you applying for a remote job? Oh, because I want to take care of my kids and my family. Wrong. It has nothing to do with them. It has everything to do with the fact that you want to work in a place where you can have full concentration. You need to focus on that. You don't need to be talking about, oh yes, I have a newborn and I have this and I have that. Because believe it or not, even though they can't discriminate against you, they're not supposed to discriminate against you. Think about this. If you have two candidates who, and think about this logically, guys. You have two candidates who come to you. One who is saying that they are so focused on, they want to learn about more about medical billing and coding, that they've been doing all their studies, that they like the peace and quiet of their home, and plus they do have an office space in their home because they want to be able to work remotely, versus a person who's saying, well, I want to work at home because I have 3 kids and I have a newborn baby, and I just would like to not have to commute and do all these things. Who do you think that the employer is going to hire? If they both tested the same way and they both have the same credential and they both have the minimal to no experience, who do you think that employer is going to hire? The person who sounds like they're more with it and they have a space, they have a plan for how they're going to work at home, versus a person who says that, oh, they have all these kids and they got a newborn baby and that's what they're focused and concentrated on. That may be your situation right now in your life, is that you may have those kids, but that employer does not need to know that. That's none of their business. All they need to know about you is that you know how to code, and that you're studying medical terminology, you're studying anatomy, you're doing all these other things to make yourself a more viable candidate for these jobs. That's what you need to do. Not that you're collecting all of these credentials and, oh, I have a CPCA and a CPMA. What do you know about auditing? If you've never been audited, how can you do that? Even though there's a lot of things that the CPMA does, how can you do that with no experience? How can you fully understand and know what the concepts are if you're not just studying from a book and memorizing and then just taking the test? That doesn't make any sense to me. When I see people who come in with a plethora of credentials and they have no experience to back it up, then what are you saying with all these credentials? You're just saying that you bought credentials. That's exactly what you're saying. Now, hold on. I know. I heard somebody just now say, oh my God, that's so mean. No, it's not mean. It's not mean. It's meant to get y'all to think. You do not need all of these credentials. If you want to get more credentials, wait 2 years. Get in the industry first. Make yourself more knowledgeable about what you're doing. Then decide on additional credentials, and credentials that are not going to overlap what you've already been tested on. Because at the end of the day, guys, remember, this is a business. Health information is a business. And for every single additional credential that you get, you will have to get more CEUs. And in some instances, like the CPMA, you can only get them from certain vendors in order to be able to maintain that credential. You can't just go and get all these free ones willy-nilly. No, friends, no. You have to get specific ones and special ones. Again, another story for another time. But back to what I'm saying. Think about what you're saying when you say, oh, well, I want to do remote medical coding. You need to think about that first. Really think long and hard on why you want to do this. Now, get you some experience, then go home, by all means. That's great. But when you're starting off brand new, and you don't have that exposure to other medical coders, it's going to get to be a long road really fast. Rather than enjoying the experience of being new. I enjoyed my experience of being new when I started, because when I started off at the temporary agency. They got me an assignment at the Cancer Therapy Research Center. I was there for 3 months. It was a 3-month assignment. There was 3 of us, and they said, okay, we're going to pick one of you, and then that's it. The other 2, we don't need. I didn't get picked, and it wasn't on technical skill. The lady wasn't a nice lady, which is fine with me, right? Because I went on to an even better assignment that I got even more money at. Now, we don't talk about money in specifics on my channel. Never have, never will. But I'm saying this to say that because I was not concentrating on the dollars right away, and I had that camaraderie around me, because the 2 ladies that I worked with, and then the lead coder that we all worked with, that helped me tremendously. And all the things that I learned from all of them. And then in my second position, having the wonderful boss that I had, she taught me a lot. And not only that, everything that I learned from doing professional fee services was what got me my job here. And all because I was around people in the beginning. And by the time I got here, and I had went, started good salary, pay bump, and then another pay bump in less than 1 year's time. So these things can happen and move along in your career if you let them. So don't come in with this automatically, I want to work at home remotely. I want to do things my way. Because when you have that, that's when things don't work out. When you let yourself experience being new, being around other people and being with providers and being with other medical coders, that's when the real magic happens. I'm just saying. So with that said, I'm going to wrap this one up. Best of luck to you guys. But if you ask me, I will always either not respond because I've already responded, or I will tell you that you need to think again when it comes to immediately starting at home remotely. I'm just saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.